So we got to watch the Powell River Kings practicing this morning, and now we've come to London. We had a lovely little break with some tea and cinnamon buns to die for. And now we are going to head all the way over to Campbell River. Why? Because they have a brand new hospital. Stay tuned for that, coming up next. You're watching Where You Live. I'm Mary Ruth Harris, and as promised, we are here in Campbell River with Dr. Jeff Beselt, standing in front of the brand new hospital here in Campbell River. How are you today?
I'm good. How are you?
This must be a very exciting time for you.
It has been, yeah. It's been a very long time in the making, and we're so excited to be working inside these facilities now.
Now, explain to me the name and the campus idea so that the general public is starting to have an understanding of that.
So we're standing in front of the Campbell River campus of the North Island Hospital. There's a long story behind this, but as some people know, there was a discussion about having one hospital or two hospitals, and where we ultimately got to is one hospital, but in two places. And so there's been a lot of work in trying to understand what would that look like and how would that be, and so this is how I would explain it. So if I injured my hand and I presented to the Comox campus of the North Island Hospital, the plastic surgeon on call would likely be in Campbell River. And so if myself as an emerge doc in Comox, that wasn't within my scope of practice, that person would then go to Campbell River and they would receive that care. And for example, for another area, maybe psychiatry, for example, maybe if I presented to Campbell River and that resource wasn't available in Campbell River, then I'd be going to Comox. And so we don't not everything is in both places. Some things are, so maternities in both, yes. but not for everything. And so the goal is to try and make it a similar experience no matter whatever campus that you present to.
Now, one of the things that's unique about the build of these two hospitals is that every room is identical. And I guess that makes it easier for the doctors and nurses.
Yeah, that's right. So many of our staff are highly specialized, and because we live in small towns, we don't always have very many of those people. And so in the past, there might be times when maybe we couldn't have enough maternity nurses or ICU nurses in one community, and that might actually mean that we had to send patients to another place. And so we worked really hard when we designed the facilities to say, okay, if it's an ICU room, it's exactly the same in Comox or Campbell River. And that way, if we ran into a challenge that way, we could invite maybe a staff in Comox to come join and work in Campbell River for that period of significant need so that we wouldn't have to move patients and families around. And so they're very, very standardized. So every emerge bay, all of the bays in Campbell River and Comox, they're exactly the same. The ORs, the ICUs, the maternity rooms, all those things are exactly standardized.
Now, we've been fortunate. We've been able to cover this project right from like a year before you even put shovels in the ground. And we've had an extraordinary experience being able to see right at the front lines the build and the construction. And it's been really awesome to watch it. And all of those videos are available on our YouTube channel, Shaw TV North Island. But I think one of the things that stands out for me in the last tour that we had with Mr. Tom Sparrow, who of course was your chief project officer, was here in the Campbell River Hospital, before it opened, the level of technology is mind-blowing.
It is, yeah. So one of our priorities that we looked at was evidence-based design. And so these aren't the first two hospitals that are built in Canada, and so how do we learn from other projects? And so technology, for sure. And so part of that is technology we're using today. And so one of the things that's actually been really remarkable is we use a type of secure texting and voice communication between our staff. It's called Vocera. And historically, it's only been audio, but in our new facilities, we're using something that allows for both for texting and audio. And the uptake from our staff has just been incredible. When you move to a new place, and our hospital is no different than any other modern hospital, it's way bigger. We were used to the emergency department that I used to work in Campbell River. I could basically reach out and touch everything from one spot. That's not the case here. And so how do we talk to each other? And so, that's an example of technology. If you look at other places, for example, in the operating room or in the maternity rooms, the technology is very different. So in our maternity rooms, for example, one of the goals there was to make it family-centered. And so when you walked into the old maternity suites in our old facilities, it looked kind of scary. You could see the technology. You could see the resuscitation warmer. And not a great thing to see when you walk in expecting to have a healthy birth. Yes. So when you walk into our new facility, everything is hidden behind beautiful cabinetry. And so if we need to use that, then we open it up and it's right there and it's ready to go. But if we don't need to, well, that's not a great family experience. And so some of it is technology that is different, that we didn't use before. Some of it's just in a new way, but it's really going to help us take better care of people now. And then if you look at the next 10, 20, 30 years, there's all kinds of different things sitting in those walls that we can then enable as we move forward and we learn how to do things differently.
Awesome. Now, the one question I have is more about the structure, the logistical structure. So Island Health has split the island into different geographical areas now. So how does that break down?
So there's 4 geographical areas across the island, and so the area that we're in is called Geo 1, and so that's essentially from Fanny Bay north. So Comox Valley, Strathcona Regional District, as well as the Mount Waddington, or what my friends in Mount Waddington call the real North Island. And the idea behind that was to say, if we look at the structure of organization, we have care or program-based portfolios, and so that is important because if you want to look at surgery, it is important to have standards across the entire island and across the province. But one of the things that we're really working on in our system right now is that we know that the best place for people is actually not in the hospital, and it's where people live and it's in their communities. And as you know, there are a lot of people across Canada who are in hospitals who are there because there's nowhere else for them. And the solution to that is having hospitals that are inside communities and working in that. And the way to work through that is to have relationships. And so to do that, you need to be where you live. And so that's really the change. And so myself and then Dermot Kelly is the executive director for the Geo 1 area. We get to lead that together.
Now, the other areas, if you could explain Geo 2, 3, and 4, like where they are.
Yeah, so Geo 2 is it basically starts on the west coast, so Tofino, Howsett, Ucluelet, okay. And then coming across through Port Alberni, it includes Nanaimo and Qualicum and Parksville. Okay. Yeah, 3 includes the Saanich Peninsula, as well as the Cowichan Valley area, and then 4 is the Greater Victoria area, exclusive of Saanich Peninsula.
Okay, that's interesting that you excluded Saanich Peninsula, but that's okay. So how is that going to assist what you guys do on the ground is to have that centralized that way?
So for example, if I look at Campbell River where we are right now, so we have Quadra Island and we have Cortez Island that are immediately adjacent to it, or in the Comox Valley there's Denman and Hornby. So as we look at how do we support people on Cortez, this is where they come. When people need extra help or care, this is where their services are done. So it's a bit of a hub and spoke sort of idea, and it's actually working really well because people have relationships, people understand the nuances. Our island is a very interesting place because not only do we have the challenges that come with distance, but we also have water. And so water adds, so Quadra is not very far from here, but that ferry doesn't run in the middle of the night, and so that really changes things. And so having people who live here understand it, they're the best position to solve some of the really challenging problems that we have.
Now, what do you think of the aesthetic of the hospital, inside and out?
Well, outside is beautiful. Inside, it's amazing. And so I had the chance to work on this project for the last 6 years and kind of see it change. And you alluded to Tom, and Tom and I got to work together through that entire period. So inside, it's extraordinary. And when I walk around, it's beautiful. Our old building, so in the emergency department, there was no windows. So, right. A lot of our staff work shift work, and so you never ever, not that it's sunny here in the winter, but just to see the daylight is really important. And so there's so much more daylight coming into the building. The colors are they're incredible. One of the things that we're really proud of is we worked very hard to say, how do we make this a building that's culturally safe? And so we worked very closely with our Aboriginal working group and trying to understand that. And so when you walk into the front entrance of both campuses, if you've ever been a big house, you'll be reminded of that. And that actually came from our architects working closely with our Aboriginal working group in a cultural safety exercise. So yeah, they're gorgeous inside, and over time more and more art will be added as well, so they'll get even better.
Awesome. Well, Dr. Beselt, thank you so much for your time today. Really appreciate it, and congratulations.
Thank you very much.
All right, you've been watching Where You Live. I'm Mary Ruth Harris. We are headed down to the Comox Valley and a discussion with the Child Development Association.